Good evening, ladies and gentlemen. Today we're going to talk about the Adrenochrome Theory of Schizophrenia by Abram Hoffer. He came up with the theory in 1950s, and he revised the theory in 1981. So we'll be going through his paper and coming up with some reasons why you should consider taking niacin or B3 or nicotinamide riboside to boost your NAD levels to prevent adrenochrome from causing hallucinations. So this is Abram Hoffer's theory of schizophrenia from that he developed from the 1950s to the 1990s when he passed away. So we'll get started with the presentation, starting with the adrenochrome hypothesis. So here it is. Here's dopamine. Dopamine is precursor is L-Dopa. You can actually supplement with L-Dopa to increase your dopamine levels. Turns into dopamine, which turns into noradrenaline, which turns into adrenaline. And adrenaline turns into adrenochrome. And adrenochrome turns into these indoles. And these cause symptoms. So L-Dopa actually can cause indoles through this pathway. Adrenochrome can cause indoles, but the most prevalent indoles that Abram Hoffer discovered was through the adrenaline to adrenochrome to indole pathway. And these are hallucinogens, and they cause hallucinations. They can cause your symptoms of schizophrenia. How the antipsychotics may work in this pathway is they block your dopamine receptors, which causes dopamine to build up in your synaptic cleft, which causes your body to produce less dopamine. So the production of less dopamine as related to taking an antipsychotic is my hypothesis for how the antipsychotics may work to reduce the production of adrenochrome. Here is the hypothesis laid out with the reactions in the body. So L-Dopa turns into dopamine, dopamine turns into noradrenaline, noradrenaline turns into adrenaline, adrenaline turns into adrenochrome, and adrenochrome turns into leukoadrenochrome and adrenolutin. And adrenolutin is an hallucinogen, but leukoadrenochrome is not. It's actually protective. This next graph here is how niacin can protect your brain from the hallucinogens. So nicotinic acid, niacin, turns into NAD with tryptophan and B6. And nicotinamide can also go along this pathway and turn into NAD. NAD prevents the oxidization. So NAD works here to prevent the oxidized adrenaline from turning into adrenochrome. It instead turns it back into adrenaline. So NAD prevents the production of adrenochrome by taking adrenaline and preventing it from oxidizing twice. So it oxidizes once and it turns into oxidized adrenaline. If it oxidizes twice, it turns into adrenochrome. And adrenochrome cannot be reversed, but oxidized adrenaline can be reversed back into adrenaline with NAD. And antioxidants can also help prevent the production of indoles too. This is some of his prerequisites for a good hypothesis for schizophrenia, and he compared the dopamine theory of schizophrenia to the adrenochrome theory of schizophrenia. There's a genetic component, so your genes can cause an increased production of adrenoleukin compared to leukoadrenochrome. So adrenoleukin can be favored in certain people, and the production of adrenaline can also be higher in certain people. If you're a nervous person, you can produce more adrenaline. And this is a genetic favorability to developing schizophrenia through the adrenochrome hypothesis. Dopamine can sensitivity or lack of sensitivity can be increased through a genetic component. There's a genetic advantage to having adrenochrome in increased spirituality. The psychedelic effect can make you more creative, more spiritual, more interconnected with people. Stress, the production of adrenaline. So stress is a trigger for schizophrenics. It causes, in the adrenochrome hypothesis, it would cause an increase in adrenaline, and that adrenaline would be turned into adrenochrome, which would be turned into indoles that caused your symptoms of schizophrenia. Dopamine has no direct connection with stress except through the adrenochrome hypothesis of doing indoles. So if dopamine turns into adrenaline, which turns into indoles, then dopamine has an effect, but only through the production of indoles. Clinical symptomology, yes, adrenochrome is an hallucinogen or its derivatives. Clinical physiology, an increase in dopamine can explain an increase in adrenochrome, and the adrenochrome hypothesis actually is just a little bit further along in explaining the connection between your symptoms and your physiology. Is B3, vitamin B3 is protective in the adrenochrome theory of schizophrenia, and Abram Hoffer proved that B3 is protective. So there's no way of explaining the protectiveness of B3 without the adrenochrome hypothesis. Cerebrology. Adrenochrome is an antihistamine, which brings down inflammation. So if you have a cerebral allergy, and the adrenochrome will be protective. And it is a hallucinogen, where dopamine is not directly a hallucinogen. Okay, so here are the supplements that Abram Hoffer took to protect people from schizophrenia. B3 niacin, nicotinic acid increases NAD levels by 1.3 times at 4 months and 2.3 times at 10 months with 1 gram per day. Nicotinamide is just as effective, but I do recommend nicotinic acid, as the flush response is actually leads to advantages over nicotinamide, which is a no-flush niacin. Hoffer gave 1 gram of niacin 3 times per day, and that doubled recovery rates. So recovery rates doubled after 30 days of use, and then waiting a year in those just diagnosed. They took it for 30 days, 3 grams a day, and after the 1 year mark, their recovery rate was doubled. With 5 years of use in chronic cases of schizophrenia, if you took it for 5 years, your recovery rate was doubled. If you have had schizophrenia for some time, you can still use niacin, and it does double your recovery rate, but you have to take it much longer than if you have just been diagnosed with schizophrenia. A better version of B3 would be nicotinamide riboside. And it's a new formulation that Abram Hoffer did not have available to him at the time he was working on this. And it leads to a much greater increase of NAD. So a 2.7 times increase in NAD with just 1 dose at 1 gram a day. But you could take 300 milligrams a day is probably fine, and 150 milligrams might also be fine. There is another derivative, MNN. I'm unsure if it works because I'm not sure if it does cross the blood-brain barrier because it is a larger molecule. But nicotinamide riboside is effective and more effective than niacin, though it is more expensive. But it works better and it has many less side effects. So I would recommend nicotinamide riboside if you can afford it. If you can't afford it, going with niacin is probably fine. So I do recommend you take B3 until you recover. Then take as needed after that. And that's what Abram Hoffer did in his patients. He gave them niacin if they recovered, good. And then if they regressed and had symptoms again, he gave them niacin again. So those with cerebral allergies, such as gluten or wheat intolerance, milk, lactose intolerance, or sugar intolerance, often could tolerate 12 grams of B3 a day. But when the offending allergen was removed, they could never tolerate more than 6 grams a day. So this, there have been studies showing that schizophrenia can be a wacky immune response, a failure of immune response, an overactive immune response. And getting rid of allergens could really improve your chances of recovering from schizophrenia. So do test yourself for allergies and make sure that you're not allergic to anything in your diet. Abram Hoffer often gave vitamin C. A different antioxidant would work too, but he gave vitamin C. He sometimes gave zinc, B6, manganese, folic acid, and B12. And B2 also might be helpful. So it might be good to take a B complex, a vitamin B complex pill with a whole bunch of different B vitamins, and consider taking some zinc. Don't take niacin if you have a risk for diabetes, as it increases insulin resistance by about 30%. Nicotinamide riboside doesn't have this risk of insulin resistance. So it is better tolerated, though it is more expensive, like I said before. Abram Hoffer claimed 50% recover naturally from schizophrenia, but 90% recover using his vitamin and mineral method of improving schizophrenia outcomes. And he also claimed that less people recovered who were taking antipsychotics. These were first generation antipsychotics, but the recovery rates profile is similar with second generation antipsychotics, though they have less side effects. And it works by stopping adrenochrome, which derivative is psychedelic, and B3 neutralizes LSD. So this was one of the reasons they discovered the adrenochrome hypothesis, and the effectiveness of B3 was because B3 neutralizes the effects of LSD, and LSD was just coming on the scene in the 50s and 60s. And that helped lead to the discovery of the therapeutic effects of niacin. So we can look at some other ways of potentially increasing your NAD. So you're trying to increase NAD because NAD is protective against the production of adrenochrome, which leads to hallucinogenic effects. Some other ways of increasing it are exercise, with a 12% increase with aerobic exercise, a 25% increase with weight training. This was done in people under the age of 55. If you're over the age of 55, the effect is even greater. Saunas led to 11% increase, but the ratio between NAD and NADH was improved by 2.6 times. So saunas can be effective too. Alcohol leads to a 40% reduction in extreme cases. So try to avoid alcohol. The next two are two supplements bodybuilders often take: malic acid and leucine. One was tested in mice and one was tested in worms, but it has been shown to be effective in bodybuilders and increasing your lifting capacity. So you could consider taking malic acid or leucine, as they are likely effective in increasing your NAD, though this is a little bit more speculative. A keto diet increases NAD. Reducing inflammation increases NAD. Calorie restriction increases NAD. Low-level laser therapy increases NAD. Apigenin leads to a 60% increase. It's found in bromine, chamomile tea, but you can't supplement directly with it. Resveratrol leads to a 60 to 500% increase, but resveratrol is quickly broken down in your body, so it may not be effective because it has a quick half-life of only 14 minutes, so it's in and out of your body very quickly. But consider exercise, saunas, avoiding alcohol, malic acid, leucine, and potentially a keto, and reducing inflammation and calorie restriction. So the adrenochrome theory of schizophrenia is a more accurate and precise theory than the dopamine theory of schizophrenia. And it often, according to Abram Hoffer, led to better results. So it's a bit sad that his theory didn't catch on. There was a vote in the 1990s, by layman psychiatrists, and they all voted to research this method more. Unfortunately, the heads of the medical associations who control the funding did not provide funding. They were there, and the membership voted to explore this theory more, but the leadership decided not to. It is remarkable that he achieved a 90% recovery rate in many of his patients, or a doubling of a recovery rate, so about 50% to 60% recovered, compared to the 10% that recovered now on those who were taking antipsychotics and niacin. So the theory is very promising. It seems to lead to better results. So I would suggest you consider taking some nicotinamide riboside or some niacin. If you want the cheaper version, niacin works. But do consider exercising, taking a sauna, and some of the other methods I've talked about to increase your NAD levels. As always, the references will be linked below. You can check them out. You can peruse the references at your leisure. As always, I wish you well on your journey with schizophrenia and your journey of recovery from schizophrenia. Thank you for watching the video. Please drop a comment if you feel so inclined. And I will talk to you again soon. Thank you. Bye.